introduction is done, you could start from your presentation. Dr. Amit, you could start with the introduction.
Yes, sir. Yes, sir. Thank you. Am I audible, sir?
Yes, yes, you are audible as well as visible.
Okay. Sir. So, good morning to all the participants. Uh, I would like to welcome you, all of you, on this 21 days national refresher course, which has been started from the 4th June. So today we have the resource person, Dr. Rajesh Singatia. So firstly, I would like to present a brief of him. So Dr. Rajesh Kumar Singatia, which will deliver his seminar on the perspectives and determination of the vaccination schedules. So first of all, I would like to deliver a brief of him, sir. He is published more than 40 research articles, and he has been the author of one book. Currently, as you can also see in this slide, he is presently working as a assistant professor, senior assistant professor in Department of Veterinary Microbiology, and he is the officer in charge of the Apex Center of the Animal Disease Investigation, Monitoring and Surveillance Center of the Rajwas, which is placed in the microbiology department. And he is also PI of the ICR All India Network Project of Antimicrobial Resistance of Fisheries and Livestock Project. And he has the vast experience in teaching and extension. He has conducted the plenty of the animal health camps, treatment camps, and exhibitions, being a officer in charge of Pasu Gyan Kendra Dungurpur and Churu. In academics, he has taught more than 12 years and developed practical teaching manuals. In research, he has worked on various aspects of veterinary microbiology, immunogenicity of a Newcastle disease virus, molecular characterization of enteric and DNA and RNA viruses. He has been member of advisory committee of 20 MSc students. He has additionally, he has attended more than 40 trainings, workshops, seminar, and symposium. He is a life member of various professional societies of India. So after this brief intro, I would like to request Dr. Rajesh to deliver his seminar. And on the behalf of all the delegates of this refresher course, I would like to welcome again and requesting to deliver the presentation, sir. Dr. Rajesh, sir. Over to
thank you, Dr. Amit, for such a nice introduction.
Yes, sir.
So, am I audible?
Yes, sir.
Okay.
You will proceed, sir.
Okay. So thank you, sir. So my topic is veterinary vaccine in India, perspective and determinants of vaccine schedules. So before going in details, we should know about what we mean by vaccine. So vaccine is an immunogenic formulation composed of an infectious agent, right, whole pathogen, or its component, or of a non-infectious substance, the administration of which result in generation of protective immune response that enable the recipient individual to withstand subsequent challenge with the same or similar pathogen, or to handle the non-infectious material in a modified manner under natural or experimental condition for a considerable period of time. So this is you can say what is the exact definition of vaccine. So what are the ideal characteristic feature of ideal vaccine? Vaccine के क्या character होने चाहिए? So this vaccine should be highly efficacious to provide solid protection. So what do you mean by efficacy? So efficacy of a vaccine is you can say the quality that confers solid protection to the host against any challenge. Challenge may be experimental or natural by the pathogen. So the vaccine should be highly efficacious to provide solid protection. Next very important point is able to provide long-lasting immunity. Okay, some vaccine provides short-term immunity, some long-lasting immunity. So vaccine should provide long-lasting immunity. The vaccine should be safe to use. Safe means there should be safety issue. Safety means safety of vaccine indicate the absence of, or you can say, endurable level of associated risk in the inoculated individual. Associated risk include local or generalized adverse condition. Sometimes there is a fever occurrence after the vaccination. So vaccine should be safe to use without any associated risk. The vaccine should be free from the contaminants. So vaccine should be purity. Purity of vaccine indicate the lack of contaminants in the vaccine formulation. So vaccine should be free from the contaminants. It should be stable under adverse environment condition. About the stability, easy to produce and economic to use. It should be cheap. If it is costly, then nobody will use this vaccine. And next, very important, easy to deliver, if possible by oral route. So these are the important characteristic feature of an ideal vaccine. So before going in detail, we should know about the background of vaccine development. So this term vaccine and vaccinology came into use after an English physician, Edward Jenner, discovered the, you can say, the smallpox vaccine. We all of know about the Edward Jenner. He is known as the father of immunology. So something about Edward Jenner, this rural physician, then aware, this Edward Jenner, aware about the farmer worker belief that if you had cowpox in the past, you would not get the smallpox. Okay, so what is the difference between cowpox and smallpox? This cowpox cause mild discomfort, itching, a few pustules, some swelling, symptom that disappeared in a few days. In contrast, this smallpox cause massive disfigurement, sometimes blindness, and often death. So this Edward Jenner, he postulated that pus in the blister that milkmaid received from the cowpox protect them from the smallpox, and he tested this hypothesis by inoculating this cowpox material into James and 8-year-old boy on 14 May 1796. At first, his colleagues, his peers, they doubted the safety and efficacy of his treatment, this procedure, but eventually the value of the cowpox inoculum was recognized. So Edward Jenner work is said to have he saved more life than the work of any other human. So that is why he is known as father of immunology. So Edward Jenner has very important contribution in the vaccine development. Next very important scientist is Louis Pasteur. So Louis Pasteur, he developed vaccine against this fowl cholera in poultry, anthrax in cow, rabies in man. Okay, so Louis Pasteur stated in statement, what he say, that chance only favor the prepared mind. Chance only favor the prepared mind, and it was the chance observation through which he discovered that a culture of chicken cholera organism lost their pathogenicity. This culture of chicken cholera organism, they lost their pathogenicity and retain attenuated pathogenic character over the course of many generations. So he inoculated this chicken with the inoculated form, attenuated form, and demonstrated that the chicken were resistant to fully virulent strain. So he prepared vaccine against this fowl cholera in the poultry. On the similar preparation, on the similar, you can say, principle, he prepared the anthrax vaccine in the cow. So in the 1879, he investigating this anthrax, and this anthrax caused epidemic in the 1879. This anthrax causing epidemic in the France and in some parts of the Europe. That's killed a, you can say, large number of sheep, and disease was also taking human being as well. Okay, so Pasteur also applied same principle of vaccination to anthrax, and he prepared the attenuated culture of bacillus after determining the condition that led to the organism loss of virulence. So he prepared the anthrax vaccine on the similar principle. Then he also worked on this rabies. And he prepared inactivated vaccine of this rabies. So first of all, he inoculated this rabies vaccine into a 8-year boy, Joseph Mister. So Joseph Mister is a 8-year boy, and he is very badly bitten by this rabid dog, and the chances of survival of this Joseph Mister was very less. So in the 1889, Louis Pasteur inoculated his vaccine into this. Joseph Mister, and this Joseph Mister was survived. And later on, this Joseph Mister served as a caretaker of Pasteur Institute at Paris until his death in the 1940 at the age of 64. Okay, so these are these two scientists, that is the Edward Jenner and Louis Pasteur. They have very important contribution in the vaccine development. So on the work of this Louis Pasteur, it is said that this Louis Pasteur added 28 to lifespan of every man, woman, and child. And he improved the quality of life because he prepared the anthrax vaccine, because he prepared the rabies vaccine. So there is a very much important contribution of this Louis Pasteur. So next is, what is the impact of this veterinary vaccine? So what is the impact of veterinary vaccine? So impact of veterinary vaccine can be understood by these two disease, that is rinderpest and rabies. By these two examples, rinderpest and rabies, we can understand the impact of veterinary vaccine. So first of all, about the rinderpest. So rinderpest is an example of you can say of how a disease that only affect animals can have a large public health impact. This rinderpest, we all know that rinderpest is a acute, highly contagious viral disease of cattle, domesticated buffaloes, and some species of wildlife. But by this example, we can say that this is the disease which only affect animal can have a large public health impact. How? So in the 1889, that cattle they ship from India, to Africa, and that the cattle they ship from India carried the rinderpest virus to Africa, causing an epidemic, that established the virus on the continent, that Africa continent. And initially, approximate 90% of the cattle in the sub-Saharan Africa died, as well as many sheep and goat also died. Wild buffalo, giraffe, wild beast population were also died. And this, and due to loss of these animals, loss of these draft animal, domestic livestock, and wildlife, they result in the mass starvation. There is mass starvation, killing one-third population of Ethiopia and two-third population of Tanzania. So there is mass starvation of human beings. So after that, due to reduced number of grazing animals allow thicket to form grassland, and these thicket they serve a breeding ground for the CC fly. They serve as a breeding ground for the CC fly, and this CC fly is a, you can say, vector for the trypanosoma. So again, this vector they cause African horse sickness in the human being. Okay, so this is the disease which only affect animals, can have a large public health impact. So after that, there is global rinderpest eradication program occurs, and this is a large-scale international collaboration involving vaccination, local and international trade restriction and surveillance. And their effort may be one of the veterinary medicine greatest achievement, and the rinderpest become only the second disease after the smallpox, and to be globally eradicated. Okay, so this is the rinderpest. And by this example, we can understand this is the only disease which affect animal, can have a large public health impact. So second example is that is rabies vaccine. So we'll all of know that rabies is a very horrible disease and dreadful disease. Rabies kill about 59,000 of people each year worldwide. 59,000 people worldwide, and out of these 59,000, 95% death occur in Asia and Africa, about 55,000. And in India, from these 59,000, 36% of world and rabies death occur in India due to this rabies. 18 to 20,000 death occur in every year. So out of these 50,000 people die of rabies every in the Asia and Africa, 98% of these cases are due to being bitten by the dogs that are not vaccinated. So again, this is the disease of you can say the public health importance, which have impact on the public health. So the source of rabies in the human can be eliminated by how? By adequate animal vaccination and control, by educating those at risk, and by enhancing access to appropriate medical care for those who are bitten. So rabies vaccine for the domestic animals and wildlife have nearly eliminated human rabies in the developed country like this Australia, Ireland, Fiji, Finland, Japan, New Zealand, Sweden, United Kingdom. From these all countries, this rabies is nearly eliminated. So next is, what is the role of veterinary vaccine in India? So role of veterinary vaccine in India is that India livestock sector is cornerstone of agriculture economy, which contribute significantly to the food security, rural livelihood, and the employment. However, this sector is vulnerable to various infectious disease that lead to the, you can say, reduced productivity, economic losses, and pose risks to the public health. So vaccination remain one of the most effective tools to control and prevent these diseases. So next important point is, what is the importance of this veterinary vaccine? So the importance of veterinary vaccine we can understood by these 7 points. So due to these veterinary vaccine, there is safe and efficient food production. There is control of zoonotic disease. There is control of emerging and exotic disease of animals and people. There is reduction of need of antibiotics. There is food safety vaccine and control of disease of companion animal and horses. Enhanced livestock this trait. So now we discuss these point one by one. That is safe and efficient food production. So these veterinary vaccine are used in livestock and poultry to maintain animal health, to improve the overall production. Okay, so more efficient animal production and better access to the high quality protein are essential to feed the growing population. So in this graph, you can say that this is the, you can say, estimated population of the world from approximately the last 2000 years through the 250. So in this graph, we see that there is, in the 2010, there is 6.9 billion population. Okay, and in the 2025, it is 8 billion. And in the 2050, it is the 9.1 billion. So as the time advances, there is increase in the population. Okay, in the 2050, the population is 9.1 billion. But the important point is, in the according to United Nations Food and Agriculture Organization, in the 2009, there is 1.02 billion people were undernourished. And in the 2023, 0.73 billion people chronically undernourished, according to report of the United Nations Food and Agriculture Organization. Okay, so population is growing and some people are undernourished. So along the growth of this population, there is also dramatic increase in the world meat and egg production is also. So egg production is also increasing, meat production is also increasing. So in this you can see picture, you can see the comparison of this meat production and egg production in the between the 1961 and the 2007. So we see that the population is increasing and this meat food is also increasing, and the world meat and food production is also increasing. But for the safe and efficient food production, when the population is 9.1 billion in the 2050, the overall food production will be increased by 70% from 2005 to 2050. There must be increase in the food production, and food is safe and efficient food production, and like the egg production, like the meat production. So the only key for this is the vaccine that preserve animal health and improve production are important component meeting this need. So vaccine is only key to provide safe and efficient food production. Next very important point is control of zoonotic disease. Control of zoonotic disease. We all of know about the zoonotic disease. So rabies, to control the zoonotic disease in animal, has a major impact on reducing the incidence of zoonotic disease in the people. There are veterinary vaccine for the following disease like rabies, brucellosis, leptospirosis, influenza, Rift Valley fever, Nipah and Hendra virus, Japanese encephalitis, Q fever are present. So like this rabies. So without rabies vaccine, it is unlikely that families would be willing to keep cats and dog as pets. So without rabies vaccine, nobody will keep these dogs and cats in their home. No? And like this brucellosis, vaccination for the brucella were instrumental in the brucella boards eradication program. So many countries, they have a severe problem with the brucellosis in cattle, small ruminants, and people due to lack of available brucella vaccine for the animals. So for the control of these zoonotic diseases, whether it's rabies, brucellosis, leptospirosis, the vaccine has a very important role. So next very important point is control of emerging, re-emerging, and exotic disease of animal and people. So first of all, we should know about the what do you mean emerging disease. So emerging disease is an infectious disease and that have recently increased in the incidence, or you can say has appeared in the population for the first time. Some emerging disease can become pandemics or epidemics like this COVID-19, SARS hai, HIV, Lyme disease, dengue virus, Zika virus. So in this picture, you can see these are the emerging diseases which affecting various animal species, like this aquaculture, virus, hemorrhagic septicemia, infectious salmonella anemia, white spot disease. In the dogs, there is a canine influenza, Nipah virus infection, Rift Valley fever. In the horse, West Nile encephalitis, Hendra virus infection. In poultry, there is high pathogenicity, avian influenza, Newcastle disease, West Nile encephalitis. In the swine, there is porcine reproductive and respiratory syndrome virus, porcine circovirus disease, foot and mouth disease, African swine fever disease, classical swine fever disease, swine influenza, Nipah virus infection, you know, and indicates high pathogenicity, avian influenza, plague which is caused by Yersinia pestis, Rift Valley fever. In the ruminants, FMD है, Rift Valley fever है, brucellosis है, Prion disease है, BSC, blue tongue, tuberculosis bone. So all those are emerging disease. Next is there are some re-emerging disease also. So re-emerging disease is disease that is returned after a period of decline, like this measles, diphtheria, typhoid. There is some exotic disease also present in the animals. Exotic disease is an infectious disease that is not normally present in the particular region or country. This can be because the disease has never been present in that particular region, or because it was eradicated and then kept out by the government control measure. But when a public health measure are not effective, or when new strain of existing disease emerge, like Japanese encephalitis, CCHF, these are the exotic diseases animal. So control of these emerging, re-emerging, and exotic disease of animal in the population is only possible with the help of vaccine. So there is a if there is increase in human animal population with accompanying environmental degradation and increase in global trade and travel, so all due to these factors, there is enhanced opportunity for transfer of pathogen within and between the species. Okay, and in most of the world, there is increased demand for the animal protein has also resulted in there is intensified commercial food animal production, and there is expanded backyard production. If there is backyard increase in the backyard production and if there is increase in the animal food animal production, both type of production face unique challenge for the disease emergence and control. So emerging genetic disease of both animal and companion animal are a major threat to public health, and we can say that it is inevitable that world will continue to experience emerging disease outbreaks in the coming decades. Huh? So due to these emerging disease, there will be outbreak in the coming decades, and there is rapid development of animal vaccine can play a key role in the controlling these emerging disease. So this is again a very important point. Next is reduction of needs of antibiotics. If we use vaccine, we can reduce the need of antibiotics. So veterinary vaccine reduce the need of antibiotics to treat infection in the animal, whether it is food producing animal or companion animal. So there is increasing concern related to the antibiotic resistance associated with the extensive use of antibiotic in medicine. Whether it is a human medicine or whether it is veterinary medicine. So producer may choose either vaccine or antibiotics to control some disease based on the cost. Based on cost, if both options are available, if vaccine is costly, then nobody use this vaccine. Then they use antibiotics. If antibiotic is costly, then they use vaccine. So if regulatory requirement of a biology company to obtain and maintain a license to produce the vaccine were to increase, if this formality and this increase, then the cost of vaccine also increase. And if cost of this vaccine is increased, then these owner, the producer, they have to use less vaccine and more antibiotics. So this is again a problem. So affordable and available vaccine reduce dependency on the antibiotics for the animal health. So this vaccine should be, we can say, the cheap and cost effective, so that they use more vaccine and there is a reduction of need of antibiotics. Next is food safety vaccine. So what do you mean by this food safety vaccine? Recently, vaccine has developed to reduce the shedding of organism that cause foodborne diseases in the people. The vaccine, they reduce the shedding of organism that reduce foodborne diseases people. Vaccine like E. coli, O57, S7 in cattle, and Salmonella enteritis in chickens. So what did the vaccine do? These vaccine do not improve the health of the vaccinated in animals. They do not improve the health of the vaccinated, but they reduce the shedding of pathogen that may contaminate animal products for human consumption. If there is decrease the number of pathogen that may contaminate eggs, they may contaminate meat. So the chances of this shedding of these organs decrease. The severity of the salmonella enteritis outbreak in the people in the United States in 2010 was due to consumption of contaminated eggs. This outbreak can be reduced or prevented if the chicken has received the salmonella enteritis vaccine. So vaccine, there is also food safety vaccine is also there. Next importance of this veterinary vaccine is control of disease of companion animal and horses. And we have already discussed there are the many disease in the companion animal, in the horse. Though this human and animal bond, there is a bond between the human and animal. This human animal bond that develop enriches the lives of both animal and people. So without companion animal, especially without companion animal vaccine, especially rabies, we have also discussed that if we do not do the vaccination in the this cat and dog, then nobody will kept this pet in their home, no? And would not experience the satisfaction of human animal bond. Next is due to this vaccine, there is enhanced livestock trade. Disease-free animals are crucial for both domestic and international market, especially in the context to export of the meat, dairy, and other livestock products. So these are the 7 points. With the help of these 7 points, we can understand. You can say the importance of this veterinary vaccine. Next, about what are the different type of vaccine. So there are different type of vaccine. Vaccine may be whole organ vaccine. In the whole organ vaccine, there is inactivated vaccine, live attenuated vaccine, subunit vaccine, recombinant vaccine, mRNA, DNA vaccine, virus-like party vaccine, and thermostable vaccine. So now we discuss what are the, you can say, the advantage and disadvantage of this vaccine. Vaccine hai, what are the advantage and disadvantage this vaccine. So first of all, about the inactivated vaccine, as the name indicates, these are inactivated vaccine. Advantage of this vaccine is there is low risk of reversion to virulence because there is nothing is viable in this vaccine. So low chances of reversion to virulence. It is safe for the immunocompromised population and is stable in storage. But there is some disadvantage also. They require adjuvant. The immunity is short-lived, and we already discussed in the what are the ideal characteristic feature of ideal vaccine. Immunity should be long-lived. So the disadvantage of this vaccine is this immunity is short-lived, and booster dose we also need it in the inactive vaccine, and they provide only humoral immunity. They are not providing cellular immunity. Cellular immune response they don't provide, and there is no DIVA capability. DIVA is you can say differentiation between infected and vaccinated animals. So these are the some disadvantages of this inactive vaccine. On the other hand, live attenuated vaccine, as the name indicate, this vaccine is they contain some live pathogen, but these are attenuated. So in comparison to this inactive vaccine, they provide long-lasting immunity, and they produce both a humoral immune response and cell-mediated immune response. These are the two major problems in the inactive vaccine. But there is also some disadvantage of this vaccine. There is a risk of reversion to virulence. They require cold storage. They are because thermolabile in nature, and there is no DIVA capability. They cannot differentiate between this infected and vaccinated animals. There is risk in the immunocompromised animals individuals. Next is third one is subunit vaccine. So they are safe because no live virus. This contain only a component of that particular pathogen. Subunit vaccine. There is low risk of adverse reaction. Their target specific viral proteins there, but again they require adjuvant. They are not providing long-lasting immunity. They again require booster dose. And then fourth one is recombinant vaccine. They are safer than the live attenuated vaccine. They can differentiate between this vaccinated and infected animals, and there is low risk of adverse reaction. But again, disadvantage is reduced efficacy in some cases. And then we already discussed the vaccine should be efficacious. Efficacy means it is what do you mean efficacy? Efficacy of vaccine is the quality that confers solid protection to the host against any challenge, experimental or natural by the pathogen. So there is a reduced efficacy in some cases. Next vaccine is mRNA, DNA vaccine. These advantages. These are rapid development, no infection risk for the vaccine, can adapt to emergent pathogen. But again, there is some problem. They require ultra cold storage. Next vaccine is virus-like particle vaccine. It is non-infectious nature. They mimic virus structure, safe and does not require by containment. Strong immune response is there because they mimic the natural infection. Problem is this immunity can vary. There is expensive in production. This is chimeric vaccine. Chimeric vaccine means they provide immunity against multiple virus, and they can differentiate between the infected and vaccinated animals. And but again, the problem is this short-lived immunity. They require further optimization and research. And last one is this thermostable vaccine, stable at varying temperature, suitable for the area with limited refrigeration, ideal for low resource setting. Efficacy can be affected by the poor storage. So these are the type of classification, and the classification of this vaccine. There are different criteria. So these are the different vaccine, and we discussed what are the advantages and disadvantages of this vaccine. So what is the diversity of veterinary vaccine? We already discussed this animal vaccine are developed and licensed for a variety of purposes. So first one is the most are used to prevent infectious disease. We already discussed, and livestock vaccine are primarily used to improve the efficiency of the production of food animals. We do vaccination in this sheep and goat, in the poultry, just to improve the efficiency of production of food animals. Companion animal vaccine are used to improve the health and welfare of the individual animal. So companion animal vaccine are just like the human being. We do vaccination in the human being to improve the health and welfare of individual human being. So similarly, in the companion animal vaccine are used to improve health and welfare of individual animal. Vaccination against zoonotic disease and foodborne pathogen we already discussed. Wildlife vaccine are generally used to control disease in some cases in conjunction with the disease control program in the domestic animals species. So next is what is the mechanism of immune response, and we already know about the mechanism of this immune response development. So the major mechanism action of vaccine is by training the immune system to recognize and combat pathogen, either virus or bacteria. To do so, these molecules from the pathogen must be introduced into the body to trigger an immune response. By injecting these antigens, it may be a virus and maybe bacteria, and these antigens may be present on this bacteria and virus. And we inject this antigen into body, and immune system can safely learn to recognize them as hostile invaders, produce antibody, and they resemble them for the further use. Okay. So once the antigen-specific antibody are produced, they work with the rest of the immune system to destroy the pathogen and stop disease. Okay. So next is, what are the different factors that hinder the development of an immune response against pathogen after vaccination? So we can say what are the different factors which are responsible for, you can say, the reason for vaccine failure. So major factor enhancing the animal vaccine failure can be raised from the, you can say, the shortage of knowledge about the vaccine, improper storage and handling of vaccine, administration of expired vaccine. So there are some other factors also. And there is some intrinsic host factor, there is some exchanging factor, there is some environmental factor, there is some vaccine factor, there is some administration factors. Sometimes in the intrinsic factor there may be age, there may be sex, there may be genetics. So there are some genetically poor responders in the vaccinated population. If this individual are genetically poor responder, then definitely there is vaccine population. In the intrinsic host, there may be sex, like this is some Brucella vaccine we only inject in the females. There may be also age. Age is also important criteria. Okay, there are some exchanging factors also. Exchanging factor like this infection, So failure due to vaccination of the animal already harboring infection and pathogen incubating for the disease. If there is infection already in the body, then there is chances of vaccine failure. If there is heavy parasite load, then there is chances of vaccine failure. If there is the animal is diseased and there is antibody treatment is going on, then there is vaccine failure. If there is and there is pre-existing immunity, if there is a passive immunity in there, then there is chances of vaccine failure. Food and feed status is also important criteria for vaccination. If the animal is receiving corticosteroid or other immunosuppressive suppressive therapy, then there is chances of this failure. There are some environmental factor like season, geographical location. So vaccination is also dependent on these factors also. Some there's vaccine factors also. What type of vaccine we are using, what product we are using, what strain we are using. Adjuvant, if you need adjuvant along with the vaccine and you are doing vaccination without adjuvant, then there is chances of vaccine failure. Those on the depot and those also vaccination depend. If you are using inappropriate low or you can say lower high dose you're using, then the chances of vaccine failure. And if we booster dose is needed and we are not doing booster vaccination, then again chances of this vaccine failure. So there is some administration factor also. If there is a faulty vaccination site and faulty vaccination route and needle size, so all these factors they are important during the vaccination. So there are some extrinsic factor, intrinsic factor, environmental factor, vaccine factor, administration factor are also there. And the important problem is due to improper vaccine schedule, there is chances of vaccine failure. Improper vaccine schedule. So next is what are the determinants of vaccine schedule in India? Due to improper vaccine schedule, there is chances of vaccine failure. So what are the different determinants of vaccine schedule in India? So age of the animal, these are the 5 points. Age of the animal, health status of animal, species specific needs, geographical factor, and regional disease variability, and veterinary infrastructure and resources. So now we'll discuss these points one by one. How this age of the animal they are determine the vaccine schedule. So age of the animal, who know that the age has a very important contribution in the vaccination. So age of the animal play a critical role in determining when vaccine should be administered. We all know that newborn animal, they typically receive passive immunity from their mother through colostrum, the first milk, which provide temporary protection against specific disease. Temporary protection up to 1.5 months, up to 2 months, after 3 months. But after this 2 months or 3 months, this maternal antibody they decline. They wanes over time, and a window of susceptibility emerges during which animal are particularly vulnerable to the infection. So to address this, vaccine schedule for the young animal are carefully planned to occur after the decline of maternal antibody, after the decline of maternity, but before the animal become highly susceptible to disease. So this is the very important, you can say, criteria for the determining the vaccine schedule. So after the decline of maternal antibody, but before the animal become highly susceptible to disease. So in addition, for both young and older animals, booster shot may be necessary to maintain immunity, particularly for disease with high mutation rates or vaccine that offer limited long-term protection. Okay. Next important point is health status of the animal. This is again a determinant of vaccine schedule. The health status of an individual is a factor in determining the vaccine schedule. The animal health can affect its ability to respond to the vaccine. Sometimes there is some stressful condition like this nutrition change, transport, or illness can make it difficult for animal to respond to a vaccine. Okay, so health status of animal is very important. So a vaccine is only safe for healthy animal. If animal is not healthy, then vaccine is not safe. So there is chances of vaccine failure. The vaccine label will indicate which animal are healthy enough to receive the vaccine. Next important that is species specific needs. So in India, we know that India has vast livestock population, include a variety of species that such as cattle, buffalo, goat, sheep, pig, and poultry, and all of which may require different vaccine and vaccine schedule. So there are different species and different species. They have different vaccine and different vaccine schedule. So first of all, this cattle and buffalo. These animals are commonly vaccinated against FMD, HS, black quarter, brucellosis. In the region where the this disease are endemic. In the poultry, vaccine for the disease such as avian influenza, Newcastle disease, Marek's disease are regularly administered to prevent large-scale outbreak in the poultry farm. And in small ruminant like goat and sheep may receive vaccine for the disease like this enterotoxemia, hemorrhagic septicemia, PPR, brucellosis. Okay, so vaccination schedule are tailored to the specific risk faced by each species, taking into account factors such as disease prevalence, animal age, and overall herd health. So this is again a species-specific needs is again a determinant of vaccine schedule. Next is geographical factors and regional disease variability. So this is again an important factor. India diverse climate, topography, farming practice create regional differences in the disease prevalence. For example, like this FMD disease, it is more frequent in certain region due to climatic condition that facilitate disease transmission. We say there is outbreak of FMD occur in this area, but not in the other area. Like in the Spain, same in the poultry disease. Avian influenza is more common in the certain region, which is influenced by the environment factors such as humidity and migratory bird pattern. So there is if there is more migratory bird pattern, if there is more migratory bird occur in the particular region, there is more chances of this is avian influenza. So vaccine schedule must be adaptable to these regional variation, which are informed by ongoing surveillance and data on disease prevalence. Next is veterinary infrastructure and resources. Okay, so this again a important determinant. The success of veterinary schedule also depend upon the availability of the veterinary infrastructure and infrastructure. So what are the different points? First is vaccine type and duration of immunity. So we already discussed there are different type of vaccine: inactivated vaccine, live veterinary vaccine, subunit vaccine, recombinant vaccine, DNA vaccine, chimeric vaccine, and they have a different duration of immunity. Some provide short-term immunity, some provide long-term immunity. Next is combining different vaccine in a single time. So there are different vaccine we combine in a single injection, like this FMD, HSBQ. So these all three are in the one injection, like in the cattle, in this dog. Pentavac vaccine is available. Next is public health and economic consideration. So there is some economical constant, especially in the rural area, and that influence vaccine accessibility. So there is some program like NADCP, National Animal Disease Control Program. They should aim to make this vaccine more accessible to the farmers and reduce the financial burden of the disease. Next is vaccine availability and distribution. So timely procurement and distribution of the vaccine by government-run clinics and the vaccine camps are crucial for maintaining vaccine schedule. So if there is no vaccine is available at the time when this vaccine is required, then the chances of vaccine failure. Then veterinary personnel and diagnostic infrastructure. So for this we need a skilled veterinarian and technician are essential to ensure that vaccine are administered properly. And while diagnostic laboratory, they have to monitor the outbreak, etc. So this is again a veterinary infrastructure and resources again determined in the vaccine schedule. So next is what are the different challenges in the veterinary vaccination in India. So despite progress, severe challenges persist that hinder effective vaccination coverage. So what are the different challenges? First very important point is pathogen mutation and vaccine efficacy. Pathogen mutation. So we all of know that disease like FMD and avian influenza, they mutate very rapidly. And if they mutate, they can reduce vaccine effectiveness. So for this, we require frequent update to vaccine formulation, because pathogen is mutating, then we need frequent update to vaccine formulation. Next very important point is vaccine efficacy and safety. We also already discussed that vaccine should be efficacious and it should be safe. So ensuring that vaccine are both safe and effective is crucial. Poor quality vaccine, if there is inadequate storage or improper administration, can undermine the vaccine efforts. So regulatory bodies like CDSCO, Central Drug Standard Control Organization, and the ICR, Indian Council of India Agriculture Research, are responsible for overseeing vaccine production and distribution to maintain high standards of quality. Hmm? Next very important point is vaccine hesitancy and awareness. So mainly in the rural area, there is misconception. There is some misconception about this vaccine, about the vaccination. So people thought if you do for vaccination, then there may be chances of abortion. There may be fever in the animal, and there is a decrease in the milk yield. So there is some misconception there, and there is also lack of awareness about the vaccination. So due to these misconception and due to these lack of awareness, they can lower participation rate. And there is a less vaccination occur. So awareness campaign are vital in educating farmers about the importance of vaccination. Next important challenge is emerging and re-emerging disease. We have already discussed about the emerging and re-emerging disease. So new and re-emerging disease such as avian influenza, brucellosis, present additional challenge to the vaccination efforts. So the disease may require novel or update vaccine as well as increased vigilance in disease monitoring and control. So these are the different challenges in the veterinary vaccine in India: pathogen, mutation, efficacy, safety, hesitancy, emerging and re-emerging disease. So next very important point is what are the future direction for the veterinary vaccine in India? What are the future directions? Okay, so future of the veterinary vaccine in India look promising with advances in vaccine technology offering new solution to long-standing challenge. For example, mRNA vaccine. So what do you mean mRNA vaccine? mRNA vaccine technology, which has proven successful in the human medicine, may offer new approach for developing vaccine for disease like FMD and avian influenza, because these pathogens they mutate very rapidly. So these vaccines successfully in the human being. So we can also go for this vaccine. Point of care diagnostics. So integrating real-time diagnostic with vaccination program could improve disease management and reduce the spread of infection. Next is vaccine delivery innovation. So alternative vaccine delivery methods such as oral, intranasal, edible vaccine would simplify administration, particularly for large herd or flocks. Okay. So next is combined vaccine. We already discussed about this combined vaccine. This combined vaccine, what do you mean combined vaccine? Combined vaccine is a single injection that contain multiple vaccine, and these are designed to protect against two or more disease or different strain of the same disease. Combined vaccine reduce the number of injection. So this is the benefit of this vaccine. So they reduce the number of injection needed to protect against multiple disease. So combined vaccine are more cost effective than administering multiple vaccines separately. So these are the benefit of this combined vaccine. It reduces the number of injection, so there is less pain to animals, and it is more cost effective. And we already discussed in the first or second slide, the vaccine should be cost effective. So now our last slide. So what is the conclusion of our this lecture? That veterinary vaccination is crucial tool in safeguarding animal health, enhancing livestock productivity, and controlling zoonotic disease in the India. Okay, so we already discussed this point. The ongoing evolution of vaccine technology promising to address gaps in vaccine efficacy and distribution. However, to overcome challenges posed by the pathogen mutation, limited vaccine access, and logistical constraint, continued investment in the research, infrastructure, and public awareness is essential. Next is effective vaccination schedule tailored to specific age, regional factors are central to success of veterinary vaccination program. Next, with national initiative like the NADCP, National Animal Disease Control Program, and the support of local veterinary authority, India is making its significant strides in improving its veterinary vaccination system, ensuring healthier, livestock population in protecting both public and animal health. So these are the different references by which I have prepared this lecture. Okay, so this is all from my side. If there is any query.
Okay. Any query or any question from the participant side? Okay, if all well, then sir, thank you very much for such an informative lectures regarding the perspective and determinants of vaccine. And I am confident enough that our participants must have updated their knowledge